The importance of a viable health system cannot be overemphasized. It is said to be necessary even for the economic growth of a nation, following the belief that a healthy population creates a wealthy nation. The Nigerian health system has evolved over time and shown resilience in tackling health emergencies. A good example was seen during the COVID-19 pandemic and response to epidemics. In spite of its strength, the health sector in Nigeria also faces challenges which include human resource and infrastructure deficit, to name a few. With a barrage of complaints in the public space about quality of care received within Nigeria's health system presently, it is necessary to inquire about how the system works, the challenges and probable solutions to them. That is our focus on today's edition of Dateline360. I'm Omotola Omojola. Thanks for tuning in. Indeed, there have been concerted efforts from government at all levels to position the health sector properly to meet the need of the populace. But that notwithstanding, challenges abound. There are allegations of wrong diagnosis, poor bedside culture, along with incompetence displayed by some caregivers and health professionals. These noted inadequacies some have attributed to shortage of qualified healthcare professionals, exacerbated by other existing challenges in the healthcare system across the country. From Ibadan, Rofia Animashaun Badmus highlights the connection between medical certification, challenges and healthcare service delivery in Oyo State.
Healthcare provider certifications validate knowledge and skills in various medical fields, enhancing career opportunities and patient care. These certifications cover a wide range of specialties, from clinical and administrative to specialized areas like quality and compliance.
There should be more supervision by the government. So government needs to check on those people they are going to give that certificate to. If truly they are qualified to be a doctor or to be a nurse or to be in medical line.
So one of the things government should do is they have to go through thorough investigations of certifications, and not even certifications sometimes, based on experience of how they work. You know, most of these people also have certificates and they do not have the zeal and the passion to work. While some of these doctors have their own personal hospitals that they refer people to. So this is one of the things that they should look to if you really want to work for the government to save lives.
Friends, a doctor that use ordinary needle to pin the patient. After then, he now started the string, which I don't think is normal.
The Oyo State health sector is actively working to improve the quality of training for its personnel, particularly within the primary healthcare system. This includes initiatives like a homegrown scheme of service for community nurses and midwives, efforts to standardize career progression, and a focus on continuous professional development.
Medicine, there are some things you must learn, you must do before you are certified to have qualified to treat human beings. So we will not in any way let down the guard just because we have people that have gone. The only thing it means is that those who are on grant, they have a lot of work to do, so there's a lot for them to do. For example, 1 or 2 people have to do the jobs of so many people.
Wrong diagnosis might come maybe because of inadequate equipment that we have in the facilities. And I've told you, that's why we refer to as resource limited. But despite that fact, people still strain to work with their clinical acumen to be able to ensure that they give the best to their client.
Wrong diagnosis is a significant problem within the healthcare sector, with consequences ranging from delayed or inappropriate treatment to increased mortality rates and significant financial burdens. Studies indicate that wrong diagnosis can account for a substantial portion of adverse events in hospitals and contribute to patient death.
Wrong diagnosis often leads to patients receiving treatments that they do not need, which in most cases leads to emotional distress, ineffective treatment, and death in some cases.
In many healthcare facilities, inadequate infrastructure can contribute to diagnostic errors. Overcrowding, lack of trained personnel, and limited access to advanced diagnostic tools can hinder accurate assessment, leading to wrong diagnosis and potentially harmful treatment plans.
Actually, when equipment are not there, it's prone to coming to wrong conclusion on the diagnosis of any patient, and that's one of the challenges that we have. And we say we must invest more into the health sector.
It is, however, hopeful that India's brain gain approach, which leverages the expertise and resources of its diaspora, can be a valuable model for Nigeria to address its healthcare worker shortage by fostering connections with Nigerian healthcare professionals abroad and creating opportunities for them to contribute to their home country.
Indeed, there have been concerted efforts from governments at all levels to position the health sector properly to meet the needs of the populace. But that notwithstanding, challenges abound. There are allegations of wrong diagnosis, poor bedside culture, along with incompetence displayed by some caregivers and health professionals. These noted inadequacies, some have attributed to shortage of qualified healthcare professionals, exacerbated by other existing challenges in the healthcare system across the country. From Ibadan, Rofia Anima Shaun Badmos highlights the connection between medical certification challenges and healthcare service delivery in Oyo State. Another noted recurrent challenge within the health sector in recent times is wrong diagnosis, which has been alleged to have led to unnecessary fatalities and undermines trust within the healthcare system. Next, Ifeoma Okafor presents a typical case of how wrong diagnosis has reduced the quality of life of a young man in Benin. Viewer discretion is advised.
The quality of healthcare service delivery has raised growing concerns, highlighting the need for proper training of healthcare professionals to ensure high-quality patient care and safety. A case in point is a young man, Promise, who suffered deformity due to alleged medical negligence.
Anytime I enter sun, I always feel headache. The thing is aching me, even at night, even safe. And you can see it's even bringing pus. There's all there. That is why I just need proper treatment. I just need justice for myself.
It can't scrape here. It can't feel the blood. Before 2 hours, I say, oh, here they black. I go around meet up for office. I say, doctor, come over here, don't black. He say, as soon as they behave. If I carry children come hospital, I know they allow doctor arrest. I bet you go. Now I live there. First time, secondly, third time, now you follow me. Really, come say, oh, here don't black. And this I call put down. This only this one call the work.
This incident underscores the importance of proper training in minimizing medical errors and fostering a positive healthcare environment.
Sad over what happened to that young man. I don't know who did. I cannot say the person is not truly certified because we're human. Errors could occur. And that's why the Ministry of Health have put some measure and the various professional bodies have measures put in place to reduce or minimize some of these errors. Probably, if the person who did the cannulation, if you're not sure, you could get a superior to say, I've been trying, please come to my rescue. Like I said, I do know what happened. It's not our institution. But even in the institution, we've had several cases. Some, they will cannulate the baby's hands and they will walk away. That's where I also mentioned that there's some very private, there are some private hospitals that are not optimal. I don't know what government is doing to monitor and probably close them down till they maintain standard.
To revitalize Nigeria's healthcare system, stakeholders must work together to address the systematic issues driving the brain drain and prioritize patient-centered care
One of the primary issues that is currently driving Nigerians away, and indeed medical professionals, is the issue of the poor working conditions. For the professionals, in terms of their career prospects, the opportunities, the incentives. In this country, we used to have a situation whereby you had incentives like car loans, mortgages.
The number of doctors in attendance are few, and then you have the growing number of population to attend to. So it's taking a toll, a very big toll, on the few doctors who are left on ground.
To address the issue of brain drain in the healthcare sector in Nigeria, and in fact the holistic development of the sector, many people believe requires a multi-dimensional approach that involves investment in the infrastructure and creating more career investment, collaboration in researches and training of healthcare personnel, and other advancements in healthcare. Ifeoma Okafor for Dateline 360.
Over 30% of its medical doctors to foreign countries in the past decade, with Nigeria Medical Association (NMA) estimation that the country needs at least 200,000 doctors to meet the healthcare needs of its population, as currently there are only about 70,000 doctors available.
About 4,000 doctors are leaving the country every year. And currently, according to the WHO standard, we should have one doctor attending to 600 people. But here in Nigeria, we have one doctor attending to about 8,000 to 10,000 patients, which this is causing a lot of workload, more call hours, you don't have much time for your family, you are not well valued, so that is why most people decide to be leaving.
Nurses and midwives have also been affected, with over 42,000 requesting verification to practice abroad between 2017 till date, according to the Nursing and Midwifery Council of Nigeria.
Out of the over 42,000 that have applied, virtually as of last month, the record shown that over 18,000 applications were processed, and these people have left, and so many also are on the queue.
These shortages is further exacerbated by the brain drain, which has seen many medical professionals leave the country in search of better opportunities.
In the year 2024, last year, we had 4,193 doctors who have requested for certificate of good standing from the Medical and Dental Council of Nigeria. If you compare that with the number of doctors that have been registered, inducted newly by the Medical Dental Council, it was 4,900. Yes, it's slightly higher than those who have left or are leaving. Some of them are seeking greener pastures because of better pay.
In Borno State, where insurgency has compounded medical challenges, the government took a bold step by introducing special incentives for doctors and health workers to attract and retain them in the state.
Borno State is possibly the only state in Nigeria that pays 30% extra salary for those who happen to be serving in rural areas. And in full preparation of this Japa syndrome, Borno has built a university teaching hospital which will be commissioned very soon, and there's also medical school which doctors will train, and nurses, midwives, pharmacists. Borno has actually built 2 nursing colleges or schools, one in senatorial district. In the southern part of the state is in Goza, and in the northern part is in Monguno, and we already have one in Maiduguri, which is the central, and we have increased the number of graduates from 50 to 150 to now 600 per year.
The Borno State government, they provide houses for their doctors, they provide the Bochma, which covers for the healthcare services. It's an insurance scheme for doctors. There is a medical training fund that the Borno State government is giving so that young doctors can train and become specialists. The federal government pays about $1 million annually. This Borno State government also pays this exact amount. Just this year, the Borno State government has also increased the allowances to be exactly as that of the federal government, which we don't see in most states.
The state government is trying its own best by seeing how maybe putting those infrastructures in place that will be conducive for this thing for work and other equipment that you need to use.
Although some state governments are responding to bridging the gap, just as federal government launched several policies, including engaging retired consultants to mentor young doctors. The NHIS now supports telemedicine in remote areas, reducing pressure on fiscal personnel, while National Assembly, on the other hand, is debating a bill mandating doctors to serve for 5 years before qualifying for immigration.
The way forward may be working out a system where if, let's say, United Kingdom wants 100 doctors in Nigeria, then it has to work out with Nigeria so that they will pay for the training of, let's say, 300 doctors.
By retaining medical professionals and improving healthcare services, Nigeria can reduce the economic burden of brain drain and promote better health outcomes for its citizens. If Borno, in the midst of security challenges, can start turning the tide, then surely the rest of Nigeria can do even more. In Maiduguri, Pauline Kujevan reporting for Dateline360.
Of infrastructure. There are ongoing debates on the effort of the House of Representatives to mandate Nigerian-trained medical personnel to serve 5 years before exiting the country. From the purview of Section 45, subsection 1 of the 1999 Constitution, as amended, can Nigeria stop a willing adult from emigration for job purpose with regards to the health sector needs?
Section 45, subsection 1 is the one that is saying that in spite of all the fundamental rights, including right to freedom of movement, personal liberty and all that, donated by the Constitution, but nothing shall invalidate an act of parliament, that is an act by the National Assembly, which is done for the good of others.
The nation's health sector is no doubt challenged, with doctor-to-patient ratio currently standing at about 1 to 10,000. Medical practitioners believe the brain drain being experienced by the nation can be transformed to brain gain with strategic incentives and policy frameworks.
We can collaborate together. It's a trade. When they come here, it's like everybody is being trained in terms of skill. They will bring it to Nigeria. We are going to learn from them. They also have to learn from us.
Thankfully, some health workers in the diaspora are already returning to Nigeria to help make the sector more viable. Experts are calling on government to improve the working condition to encourage more to return.
The moment you address that remuneration issue, you have addressed more than 50% of it. Many of those other things will fall in place, and then we can begin to talk of how to bring back those that are already there and how to infuse them back into the system.
As Nigeria strategizes towards making its health sector stronger, experts in the field say engagement with practitioners is key in addressing critical issues.
Recognizing the healthcare sector as a cornerstone of human capital development and national progress is a priority for any serious nation. In Nigeria, the responsibility for providing health services is shared across all levels of government. In recent years, there have been deliberate efforts to reform and strengthen the sector, backed by strategic investments and the development of a roadmap aimed at achieving universal health coverage by 2030. Oluseyi Adiagbo explores ongoing national initiatives to reposition Nigeria's healthcare system, highlights the challenges, progress, and prospects for improving the overall well-being of the population.
As a fundamental human right and a key pillar of inclusive governance, in Nigeria, the healthcare system has made gradual progress in infrastructure, policy reforms, and access. Nigeria's healthcare spending continues to fall short of the 15% target set by the 2001 Abuja Declaration. In 2024, health received just 5.5% of the national budget.
Our major donor is gone. So it behoves on us right now that the budget for health, especially some critical components like immunization, vaccinating our children, should not wait. So some component of health should actually be in the first line charge.
Since independence, Nigeria's health system has evolved from a centralized colonial model to a more decentralized and policy-focused approach, emphasizing primary health care.
Was to improve the governance in the sector, to bring the federal government, state governments, local governments, private sector, civil society, and development partners to orient us towards serving the Nigerian population, to be more transparent, more accountable, and to use data in the decisions we make.
The full potential of the country's healthcare infrastructure and personnel, successive governments continue to ensure greater investments in health education, leadership development, digital health innovations, and retention strategies.
Under the leadership of President Bola Ahmed Tinubu, we've seen a very deliberate effort for Nigeria's health outcomes to be improved, for the trajectory to change, for the primary healthcare system to be more functional, for the secondary and tertiary facilities to be enhanced with investment that are real and tangible. Of course, after years of neglect, the system is not yet perfect, and there's still a long way to go, but we are on a path that is very positive.
We have created a system that is not just vertical, a system that is longitudinal, that is able to integrate with what the state is doing, what the local government is doing, and that is why we have this sector-wide approach, which everybody has subscribed to. We have a mechanism to support them in developing annual operational plans so that everybody understands what everybody is doing, and we're working as one team to deliver health to Nigerians.
There are signs of progress. The Basic Healthcare Provision Fund, BHCPF, is being gradually implemented to improve access to primary care for vulnerable populations. The National Health Insurance Authority (NHIA) Act signed in 2022 aims to achieve universal health coverage by making health insurance mandatory for all Nigerians.
We have now directly, revitalized about 340 or so PHCs across the country. Many of that have been completed. Many of that are still in process. And also working with the states and partners in all, another 500. So we have 862 primary health centers that between when we started and now, they have moved from being substandard to what we call level 2.
What we have here is an intentional focus on the poor and vulnerable. So through something called the Basic Healthcare Provision Fund, a lot of resources, about 1% of consolidated revenue.
Ultimately, a strong healthcare system is not a luxury. It's a cornerstone of peace, progress, and national prosperity. In Abuja, Olusheye Adiagbo for Dateline360.
And with that report, we conclude this edition of the program, and I hope to come your way again, same time on the network service of the NTA with another issue of interest. Omotola Mojola is my name, and on behalf of the production crew, I thank you for your time. God bless Nigeria.